See you later.
Bye. Okay, Ken is gone and we can now focus on women and diabetes. Not that we have secrets, but guys don't need to know. There are quite a few health issues that affect women with diabetes differently than they do men. And sometimes the same issues affect women more than men. So let's talk about these issues in depth. This video focuses on women's issues only. If you're a guy, and particularly if you're squeamish, this is not for you. See you in the next video. This video is focusing on women's issues only from patients' perspective. Specifically, we look at hormonal cycle and its effect on blood sugar control, gestational diabetes, urinary and vaginal infections, sexual health issues, and body image. So guys, watch if you want, but this video really is for women. Diabetes sucks.
But at Simply Diabetes, we can help you manage your diabetes cheaper and easier.
We are not medical professionals. We are people with diabetes, just like you.
Welcome. If you find this information useful, give us a like, subscribe to the channel, and tell your friends about us.
Now that the guys are gone, we can talk specifics. Men don't have to deal with menstrual cycles and with menopause, both of which affect blood sugar. Hormones can have a huge effect on blood sugar, especially for women. Here's how it works in plain terms. Hormones dictate a lot about how our blood sugar behaves. Our body's hormones, especially estrogen and progesterone, shift throughout the menstrual cycle. And those shifts can change how sensitive the body is to insulin. That's why some days your blood sugar is very predictable, and other days you scratch your head trying to figure out why your glucose suddenly went crazy. So here's what happens. Just before your period, our progesterone rises, and often that makes the body more insulin resistant. So a dose of insulin or your regular meds that normally works well suddenly isn't enough, and blood sugar rises. If that's not enough, we can also start craving more food, and especially things that don't do us any good, which is simple carbs like cookies or chips. This is double trouble for glucose management. When the period starts, hormone levels drop suddenly. So now you could become more insulin sensitive. If you adjusted your meds higher just before your period started, you need to lower the dosage again, or you risk low blood sugar. But that's not true for everybody. Some women see spikes because of inflammation, stress, or changes in eating or sleeping. After your period is over, estrogen rises and your insulin sensitivity usually gets better. Your blood sugar stabilizes and life is good, but not for long. When you ovulate, estrogen peaks, but there's often temporary increase in insulin resistance there too, thanks to other hormones like luteinizing hormone. Some women notice small glucose spikes for a day or two. No wonder we have more difficulties with blood glucose than men do. This is how it works in general, but we each are different, and so hormonal changes affect us differently too. If you get pregnant, things change again. You can get gestational diabetes. If you do, your risk of developing type 2 later increases. But that doesn't mean you will definitely get diabetes. I have friends who had gestational diabetes that resolved after the baby was born. If you already have diabetes before you get pregnant, you need to be more careful, as diabetic pregnancies are higher risk. That doesn't mean things will necessarily go bad, but it does mean you need to take better care of yourself and your unborn baby. If you are planning to get pregnant soon, now is the time to get your sugar under control. The better you manage your diabetes before you get pregnant, the better both for you and for the baby. Then comes perimenopause and finally menopause. Now we really are riding a roller coaster. Estrogen and progesterone become crazy low one time, soaring high the next time. Yikes! Blood sugar patterns can feel random. If you have hot flashes or have trouble sleeping, it can get even harder to manage sugar. So, what do? We can do a few things actually. Track your cycle and your blood sugar changes as one thing. Try to find a pattern. Talk to your doctor about adjusting insulin or meds to work with your cycle. Not all doctors will do this, particularly if yours is a GP and not a specialist. Maybe it's time to find a good endocrinologist if you are having a lot of trouble with your blood sugar around your cycle. If you know a low can be coming, be prepared. Keep snacks for lows handy. This is a good idea in general, but particularly important during your period. Eat well and exercise. I know I say it a lot, but that's because it's so important. Remember, you're not alone. Many women experience the same thing. You're not crazy. So that's it about hormones. Let's now talk about infections. It might sound a bit gross, but we always have some yeast somewhere on and in our bodies, no matter how clean we are. Blech. A healthy body naturally keeps yeast in check, preventing full-blown infections. But diabetes is a different story. If your blood sugar is high, your kidneys need to work extra hard to lower it. The result is sugar in your urine, which you simply pee out. This sounds like a great solution, but unfortunately it comes with a complication. The yeast around your private parts loves this extra sugar because that's its preferred food. The yeast multiplies rapidly and can overwhelm your body's ability to control this growth. The result is a yeast infection. It's more common in women because we have more genital folds for the sugar to collect in than guys do. Incidentally, yeast can grow in other places on your body too. But for diabetes, your private parts are the prime area, particularly for women. In fact, I was diagnosed with diabetes partly because of frequent yeast infections that kept coming back no matter what I did. If you take medications such as Jardiance or Farxiga, these meds can cause your kidneys to remove sugar from your bloodstream by peeing. So your risk of yeast infection goes up. I briefly took the lowest dose of Jardiance and it was yeast city. I had infection after infection until I gave up on this med. This is an unfortunate side effect because Jardiance worked well for me otherwise. If it happens to you too and you can't tame the infection, your doctor can find a different medication that won't have this side effect. The good news is that you don't need to be at the mercy of yeast. Prevention is your best approach here. Keeping your blood glucose in check goes a long way toward yeast control. Eating fermented foods such as natural yogurt help balance microorganisms in your body and boost your immune system. Another tip is to clean meticulously each time you use the bathroom. Wash your private area thoroughly so there's no sugar hiding in there. If you have access to a bidet, use it. I use mine religiously when I'm home, and I would never give it up. There are inexpensive bidets available online that you can install on your own existing toilet. I highly recommend bidets. When I'm not home, I clean the best I can and use my bidet immediately after I get back. I always have a water bottle in my purse, so I spill a little bit of water onto folded toilet paper and wipe with that. Then I wipe with dry paper. It's not ideal, but it's better than just wiping dry, leaving sugar on your body. After you clean, make sure you dry the area well. Yeast loves moisture, so we want to give it less. Also, wear underwear made of cotton rather than synthetic fabric to control moisture. If you feel yeast infection starting out, the best thing to do is act immediately. My go-to treatment is unpasteurized apple cider vinegar. Pour some on a cotton ball or a folded piece of toilet paper and distribute it where it itches. My grandmother used to swear by chamomile tea, which she applied the same way. If homemade methods don't work, it's time to ask your doctor for medication. It should resolve the issue quickly, and then you go back to prevention. Okay, the next women topic is libido, or lack of it. Diabetes can impact women's sexual health, including libido. It affects blood sugar regulation, hormone levels, and blood flow throughout the body, including the private parts. The result can be a low desire for intimacy. On top of that, high sugar can cause nerve damage, which makes it even worse. We saw earlier how hormones affect sugar, but it goes both ways. Diabetes can throw hormonal balance out of whack too. This affects crucial hormones like estrogen and testosterone. Yes, women have testosterone too. These hormones play a significant role in sexual arousal. On top of that, some diabetes medications can have side effects that affect libido. When our bodies are out of whack, it's no wonder we don't feel interested. Just like for men, blood flow to your sexual organs plays a vital role in your arousal. Damage to your blood vessels and nerves can ruin your experience of sexual desire. It's not as simple as blame it on all diabetes. There are other factors. If your blood sugar fluctuates widely, it can leave you feeling exhausted. And in turn, your desire for sexual intimacy dies off. I mentioned some meds can have side effects that affect libido. We already know that some medications can give you yeast infections. It's hard to feel romantic when you're itchy and worried about infecting your partner. Other meds can affect your desire in more subtle ways. Talk to your doctor or pharmacist about your medication and its impact on your libido. We women are often expected to put other people's needs ahead of our own. But this is the time to prioritize us. Set aside time for meditation and relaxation, yoga, or deep breathing, all of which relax and distress us. I used to think this was all fluff, but I couldn't have been more wrong. Relaxation and mind-body connection can help tremendously. And of course, a healthy lifestyle can also improve our sexual health. Regular exercise, a balanced diet, and enough sleep can boost your energy level and enhance your overall well-being. It's a lot easier to be aroused when you feel good overall. Don't let anyone tell you it's all in your head. All the things we just looked at are normal and affect a lot of women. Talk to your doctor if you need help. If your doctor dismisses you, find a better doctor. They are not all the same. We have a video about how to choose a doctor. I added the link to the description. We need to maintain open and honest communication with your partners. I do my best to share my feelings, thoughts, and concerns with Ken. Your partner can and should be your emotional support. Feeling supported can make us women more open. Remember, libido fluctuates. There will be times when nothing works and times of great desire. Relax, it's all normal. There's one more thing that affects our libido: body image. All of our lives, we keep hearing how we'd be so much more desirable if only we lost weight, had more of this and less of that. I finally said, fluff it. I'm not going to torture myself to meet someone else's unrealistic standard. If you want to know more about how we manage our body image issues, check out our video about it. The link is in the description. There is one more area that specifically affects women: heart health. Did you know that women with diabetes face a higher risk of heart disease than men? Not only that, we are often undiagnosed or misdiagnosed. My mom almost died of this a few years ago. So this is why keeping your blood sugar in check is so important for us. One more thing. If you suspect heart trouble, don't ignore it. Go get checked out and advocate for yourself if you run into a medical brick wall. So there you have it. Some specific women concerns when managing diabetes. It can feel like we are going crazy, but we are not. We're just different from men, And now you know what to do about it. So share your thoughts and concerns in the comments. Let's help all the women manage diabetes better. Don't forget to like, share, and subscribe. See you next time. Until then, keep your blood sugar in the healthy range.